Hey viewers, welcome to fullbodyhealth.in. Today's video, we'll be talking about psoriatic arthritis, psoriatic arthritis types, psoriatic arthritis symptoms, psoriatic arthritis diagnosis, psoriatic arthritis treatment, psoriatic arthritis diet. If you learn from this video, please hit like and share to your family members and friends. If you have any question, please let us know in the comments below. Psoriatic arthritis is a chronic arthritis that affects the joints. This inflammatory arthritis can affect any joint of the body but usually affects the fingers and toes. It usually affects patients with psoriasis. Psoriasis is an autoimmune disease that causes red, scaly patches on the skin, but it occurs in people who do not have this disease. According to statistics from the National Psoriasis Foundation, research estimates that there are about 8 million people suffering from psoriasis in the United States, of which 10% to 30% suffer from psoriatic arthritis. The disease causes inflammation, swelling and pain in the joints. This is usually mild, according to the National Library of Medicine. However, if left untreated, the severe form of this disease can cause permanent and disabling joint damage. The disease usually begins about 10 years after someone starts showing symptoms of psoriasis. In about 15% to 20% of the population, arthritis begins before the onset of psoriasis. Some people have both at the common time. Although children can get psoriatic arthritis, it usually occurs in people between the ages of 30 and 50. Psoriatic arthritis has no cure, but early diagnosis and treatment can prevent permanent joint damage. The focus of treatment is to control symptoms and slow the progression of the disease. Psoriatic arthritis types. There are 5 types of psoriatic arthritis: symmetric psoriatic arthritis, asymmetric psoriatic arthritis, distal interphalangeal predominant, spondylitis, arthritis mutilans. These are depending on the body part affected and the severity of the inflammation. 1. Symmetrical psoriatic arthritis affects the same joints on both sides of the body and usually appears in pairs, such as knees or wrists. It is believed to be similar to rheumatoid arthritis, with symptoms ranging from mild to disability. 2. Asymmetric psoriatic arthritis can affect any joint, but it does not usually occur in pairs and symmetry on both sides of the body, like symmetric psoriatic arthritis. It usually affects fingers and toes, making them look like sausages. It is generally mild, but it can severely affect some people. 3. Distal interdigital dominant psoriatic arthritis, DIP, is often confused with osteoarthritis and affects the fingers and toes distal joints, the small joints closest to the nail, and may cause nail changes. 4. Spondylitis is inflammation of the spine, which can cause stiffness in the neck, lower back, spine or pelvic area. This will make travel difficult. 5. Arthritis mutilans is an extremely severe form of psoriatic arthritis characterized by resorption of bones and the consequent collapse of soft tissue. When this affects the hands, it can cause a phenomenon sometimes referred to as telescoping fingers. Psoriatic arthritis symptoms are fatigue, joint pain, tenderness, swelling in fingers and toes, reduced range of motion, stiffness and fatigue in the morning or after resting. Psoriatic arthritis diagnosis. Currently, there is no clear diagnostic method for diagnosing psoriatic arthritis. It is usually diagnosed by combining clinical findings. The doctor will ask you questions about your personal medical history and family history of psoriasis or psoriatic arthritis. Perform a physical exam of your joints. X-rays may be taken to detect changes in cartilage or bone damage. Blood tests may include the rate of precipitation to detect inflammation, rheumatoid factors to rule out rheumatoid arthritis. HLA-B27 genetic marker test used in more than 50% of patients with psoriatic arthritis with body inflammation. Psoriatic arthritis treatment. Although there is no cure for psoriatic arthritis, but there are some treatment options that can slow the progression of joint damage, correct the range of motion, and control pain. These drugs are used to treat psoriatic arthritis. 1. Non-steroidal anti-inflammatory drugs. Over-the-counter non-steroidal anti-inflammatory drugs such as Aleve, naproxen sodium, and Advil, ibuprofen, can reduce inflammation and pain. 2. Immunosuppressants. Immunosuppressants can suppress the immune system to control inflammation. Also control other symptoms of psoriatic arthritis. Examples are cyclosporine and azathioprine. 3. Disease-modifying anti-rheumatic drugs. Slows down the progress of psoriatic arthritis and protects the joints from more serious damage. Examples are methotrexate, sulfasalazine and leflunomide. Biologics. Biological agents target specific areas of immune response, while apremilast can reduce the enzymes that control inflammation. You may need to change your lifestyle to reduce pain. Some habits are including regular exercise to help strengthen your joints and lessen pain. Stop smoking. Eating a healthy, vegetable-filled diet to help reduce inflammation. Strengthening your bones and joints. Using heating pads or ice packs to relieve joint pain. Psoriatic Arthritis Icd-10. The ICD-10 code L40.59. Used to specify conditions or terms like psoriasis with arthropathy or psoriatic dactylitis. Psoriatic arthritis diet. Eating healthy has no direct effect on psoriatic arthritis symptoms, but it can help in a number of important ways. If you want to consider changing an important eating habit, choose foods that are good for your heart. Heart disease is a comorbidity of psoriatic arthritis. This means that people with psoriatic arthritis are also more likely to develop heart disease. Choose your diet which is more anti-inflammatory. More fruits and veggies, less processed food and sugar. Your diet includes fish, nuts and seeds, fruits and vegetables, olive oil, beans. Limited use of foods on this diet are fatty red meat, manufactured foods, refined sugar. If you learn from this video, please hit like, subscribe and share to your family members and friends. If you have any question, please let us know in the comments below.